Good morning. Welcome to the very first webcast series, The Reality of Virtual Healthcare Services. By the end of our 30-minute session, I hope that you will find that the answer to the question, is virtual the new reality, is a yes. Because our webcasts are only 30 minutes, I'll answer questions that were submitted during the registration. And if time allows, I will answer the questions that are submitted through the Q&A button during the webcast. And if we run out of time, the answers will be posted in a link that has the recording. So let's get started. Virtual health is growing. Why is that? Some compelling reasons for growth of virtual health are the mounting evidence that it improves outcomes, saves costs, and patients have better access and convenience. It coincides with healthcare's direction of patient-centric care, and it offers a better consumer experience that is important with today's consumer who has to pay more for their healthcare. So consumers have more access to smart devices today. Their expectations for healthcare are now similar to other industries. The policies for reimbursement are changing, and the transition to value-based care is on the horizon. So what is virtual care? Our definition for virtual care today is that virtual care is comprised of both technology and services. Virtual health enables continuous connected care via digital and telecommunication technologies. Telehealth and telemedicine are a subset of virtual care. In general, telecommunication devices are used to transmit health and medical information. So here on our list, we have portal consultations, physician-to-physician consults, video visits, wearable data integration, remote consults, remote monitoring, remote coaching, robotics, and digital assistants. So it's not new. Virtual is simply no-touch care. It is the delivery channel for healthcare services. The convergence of digital media, health technology, and mobile devices brings us virtual care. And that includes modalities such as text messages, digital assistants, and tools that use artificial intelligence and augmented or virtual reality. The goal is to create a continuous connection between physicians, patients, and other caregivers. So what are some of these virtual health services? Most consumers who have tried virtual visits report a high level of satisfaction. So some examples are after-hours appointments, exams for acute non-urgent conditions, such as a sore throat or a rash. These are the common video visits that most people think of when you go to Teladoc or Amwell. Follow-up appointments after seeing a doctor in person, medication reminders, the ability to discuss a specific concern with a health professional. And a good example of this is dermatology. Patients can snap a picture of something that they're concerned about and email it to their doctor or send it over a secure channel. Follow-up care services at home after hospitalizations. Tracking health status, which includes blood pressure, blood glucose, pulse rate. Mental health therapy. Communication, both patients and providers find telehealth a good communication tool. And education about a specific condition. So the good news is consumers and physicians are both interested in telehealth. Why do consumers want virtual health? Because they want care on their own terms. They want to determine where, when, and how much they pay. Immediate care is better for them than waiting for in-person care. And these days, the average wait time for in-person care is 2 weeks. Consumers of all ages use technology in all aspects of their lives. 92% of them shop online, and 83% use online or mobile banking. And they don't want healthcare to be an exception. Visits have grown from 21% in 2017 to 25% in 2018. Consumers want providers to make healthcare easy. So doctors are saying yes to virtual health as well. 9 out of 10 physicians see the benefits of virtual care, specifically improving the patient experience. 14% of providers have video capability, but only 18% plan to add it in the next 2 years. So it may be difficult or a challenge to get virtual care from all physicians. They believe it helps improve patient access, it improves patient satisfaction, and it allows providers to stay connected to patients and their caregivers. It improves care coordination, outcomes, and quality, and it has the potential to improve cost effectiveness. It also offers physicians flexibility in their schedule. They believe that they can attract and retain patients with virtual health, and they also see virtual health as being on the leading edge. So what is the technology that's most adopted? Patient portal consultations, which includes email, has the highest adoption rate. Doctor-to-doctor consultations are next at 17%, and virtual visits at 14%. For all other virtual health, remote care management and coaching, remote monitoring at home, or remote monitoring at facilities, and integration of wearables, each of those is less than 10% adoption. So what is the physician's willingness to have a video visit? So this shows physicians broken up by different age groups. So the younger groups, 25 to 34 and 35 to 44, are pretty much in the mid-70s percentage that are willing to have a video visit. That drops for the 45 to 54-year-olds to 70%, and then a bigger drop for the 55 and older physicians. So the younger groups are more willing. The drop in 55 years and older is not really surprising. They've been established in their practice over decades. They're more entrenched in their habits and workflow and want to avoid disruption. So they, depending on how old they are, they're closer to retirement age. And because of that, they're probably less willing to make an investment into virtual healthcare. What is virtual's impact? Improved medication adherence, reduction in hospital length of stay by 14%. It also has helped decrease readmission rates. Many attribute this to the remote monitoring that takes place after a patient is discharged. It extends the physician's reach as well as other healthcare professionals. It gives the provider the ability to monitor the health and fitness of their patients, and the patients themselves can monitor their health and fitness. And then there's a reduction in costs to health systems and health plans. One example is Intermountain Healthcare in Utah, which did a study of their claims. And upon analysis, they found that the telehealth claims saved on average $367. So some of the drivers of virtual health are the biggest one, convenience to patients, 59%, potential cost savings, ease of prescription refills, and more frequent communication with a healthcare professional. Other drivers include consumer access, outcomes which are better because a result of timely, consistent, and appropriate care, the growing demand and increasing dissatisfaction with the status quo. So the younger generations are more dissatisfied with traditional models of care. The millennials and Gen Zs, those are the people born, Gen Z are born 1997 or later, are the most dissatisfied with their healthcare, especially in the areas of convenience, the lack of transparency of costs, and the lack of responsiveness to follow-up questions. Also, the younger generations prefer to use digital platforms and they'll choose their providers based on the availability of their provider to offer digital tools. So something that's important to note is that the millennials, these 23 to 38-year-olds, will be the largest generation in 2019, this year. And so they will have a lot of power to influence future healthcare models. So other drivers are advanced technology. Advanced technology makes it easier to start incorporating virtual health into daily life. Digital assistants, the Alexa, Google, Echo, these are commodities. And commodities means the price will go down, and there will be also more competitors in the areas of digital assistants. So digital assistants will start becoming more and more common. Wearable devices, such as the Apple Watch and Verily Watch, these are no longer just watches. They have FDA approval. They can do EKGs, electrocardiograms. And Apple's Watch also does fall detection if you wanted to monitor an elderly loved one. And then, of course, there's fitness and sleep tracking apps. Another contributor are large employers. Their sponsored health plans for telehealth benefits has increased from 48% in 2015 to 74% in 2016. And then there's physician burnout. There's a high correlation between physician burnout and interest in telehealth. We know that physician burnout is pretty much considered a crisis these days. So the physicians want flexible work-life balance to help them avoid burnout. They are happy to work remotely if they can have flexible hours and provide quality health care. And that makes virtual health attractive to them. So who are these virtual health users? Well, all the age groups are interested in virtual care. 77% never had a virtual visit, but 57% are willing to try. 77% who had a virtual visit also had high levels of satisfaction. Consumers with chronic conditions are more likely to have a higher level of satisfaction with virtual visits. And now this next one is interesting. The males 18 to 34 years old are a segment that has been difficult to get them engaged in their healthcare. Most likely it's because they consider themselves mostly invincible. But in spite of that, 27% had virtual services. So here's where virtual healthcare has actually had an impact and was attractive to a hard to reach population. Millennials, the 23 to 38-year-olds, use technology for healthcare more than seniors, but the seniors who do use it, half of them use it to fill prescriptions. And then primary care physicians use virtual health more than specialists. So talking about segmenting the population for virtual care, if we break them up into age groups, and then with seniors being the oldest group, and then break up the seniors into whether they are tech savvy or not, we're looking at their interest in using technology for their healthcare needs. So the light blue line are the tech savvy seniors, and the dark blue line are those who are not. So the tech savvies tend to be male, they've attended college, and they have a higher income than the other seniors. So 62% of the second group of lines are interested in monitoring their health issues, whereas only 23% of their counterparts, the light blue, the non-tech savvy, were interested. The same goes for collecting, storing, and sending health information and data to clinicians, the bottom line, 61% versus 19%, and then measuring health and fitness goals. So the tech-savvy seniors are about 3 times more interested than their non-tech counterparts. So there's always consumers, there are always people who are hesitant to try new things. So in survey shows that even those who are not interested in trying virtual health will try given they have encouragement or the right situation. So one of the reasons that they would try it is if it's way more convenient than traditional in-person services. That's the biggest mover. Next, if their physician nudged them to try virtual health, they would do it. And that's followed by encouragement by the health plan or an employer to try virtual health. So even though they say they wouldn't try it on their own, if someone asked them to try it, the right person asked them to try it, or even the plan or employer, they would do it. So what are the users doing? The consumers are interested and using technology to transmit data, refill prescriptions, receive medication alerts. Consumers' use of wearables and apps increased from 32% in 2017 to 42% in 2018. So that's 10% in 1 year. They use it because they think it's helpful to track their fitness, their sleep quality, exercise, and diet goals. They want to be able to understand their own health conditions, and they want to be able to communicate with their physicians. So they are using digital assistants, Amazon Echo, Alexa, Google Home. These are all popular. And once they are set up in the home, they're easy to use. So of the consumers who use technology for healthcare, 75% use digital assistants to receive reminders or alerts about medication, and 72% use digital assistants to monitor health. Some hospitals are using digital assistants to replace the traditional nurse call button for assistance. They're also using it for patients to be able to state their meal preferences and as a wayfinder in hospitals. And I thought that this was really interesting because as a wayfinder in hospitals, and it doesn't seem to matter whether they're big hospitals or small hospitals, that a patient or a visitor can go up to a digital assistant and say, where's the radiology department? And the digital assistant will tell them how to get there. Or they might say, where can I get some food? And the response will be instructions on how to get there. So what are some of the physicians' barriers to adoption? Well, the biggest one, and it still is reimbursement uncertainty. But changes are on the way, and so the reimbursement questions or uncertainty is getting a little bit better. I want to talk about a couple of them in just a little bit of detail from CMS and Medicare. So effective this year, Medicare decided that certain kinds of services that are furnished remotely using communications technology are not considered Medicare telehealth services. So that's a really fine distinction. So these services that are using communications technology, but not telehealth services, they're not limited by the telehealth restrictions of Medicare. So Medicare will pay for virtual check-ins to determine if an office visit is necessary. And they'll also pay for remote evaluation of pre-recorded patient information along with interprofessional internet consultations. So this is really creative. It means on the behalf of Medicare, especially for a government agency, so they're doing pretty good here. But it means that in the future, Medicare will reimburse for telehealth that's not a direct substitution of an in-person visit. So that's a big thing. The second thing that CMS did is for MA or Medicare Advantage programs where they eliminate geography requirements, and they also will cover all of Medicare Part B services conducted via telehealth. So although telehealth is not mandated and the plans can still decide on their own what additional telehealth services they want to provide, this is a good thing, and it's effective 2020, next year. So other barriers are the lack of access to technology, security and privacy of patient data, clinical appropriateness is sometimes a concern with the physicians, and Cleveland Clinic, for example, took steps to address these concerns. And some of these steps included quality review of videos, some templates for documentation, and they also created an antibiotic stewardship strategy. And then the last one is cultural resistance from frontline staff. And that is to be expected because there is a lack of familiarity with equipment and how to use the software. There's, of course, a disruption to the workflow or a change in workflow, and skepticism about the new ways, and changing roles and responsibilities always causes reluctance to new approaches. So this is a 24/7 virtual hospital. It is called Mercy Virtual Care Center in Chesterfield, Missouri. They are the world's first facility dedicated to telehealth. So you see this building, but there are no patients in there. The patients are in hospitals, physician offices, or at the patient's home. They offer 4 services: virtual ICU, virtual stroke, virtual hospitalist, and virtual engagement. So the virtual ICU is the largest single hub in electronic intensive care unit in the nation. They offer doctors and nurses to monitor patients' vital signs and a second set of eyes to 30 ICUs in 5 states. Their V-stroke service is for community emergency departments across the country who don't have a neurologist on site. So with the telestroke program, patients who come to the emergency department with symptoms of a stroke can be seen immediately by a neurologist via two-way audio and video connection. So this is not an isolated one-off thing. I think that most of us have heard that this practice is actually being put in place in many places across the nation because of the well-documented and well-known fact that somebody presenting with stroke symptoms, that the quicker they're diagnosed and treated, that the better outcome it is for the patient. Their next service, V Hospitalist, which is a team of doctors dedicated to seeing patients in the hospital around the clock using virtual care technology. Now, they can order needed tests, they can read results, and all of this results in quicker care. And the last one, V Engagement, where Mercy provides continuous monitoring for more than 3,800 patients, where they can provide a quick intervention. So these are patients who are not in the hospital, they're in, like skilled nursing facilities and other types of institutions, non-acute institutions. So they can actually have a doctor examine a patient virtually and get them the care that they needed more quickly, and possibly avoid the need for hospitalizations. So this big building is also designed to be a workspace for developing innovations in patient care. They also do virtual care training and product testing. So those are the people that occupy this beautiful looking building. So what are the success factors needed for virtual health? Connected coordinated care is what virtual care enables for the patient and the physician. So strategy, you need to start with an end in mind to formulate virtual health strategies that align with long-term vision and fiscal goals. Whether implementing a new virtual health initiative or scaling up an existing program, the health system should have the right infrastructure and strategies in place. Next, consumer-centric services. Profile and target your consumers. You need to offer a differentiated virtual health experience supported by a clear value proposition that promotes appropriate utilization, patient retention, and improved outcomes. Healthcare organizations should really segment their populations and continue to seek feedback on the patient experience. And we saw segmenting in today's presentation with the males or in that 18 to 34 age range, and the seniors who are high-tech savvy. Next, align and engage the workforce. Workforce readiness and engagement is needed to advance the virtual offerings that focus on quality, patient experience, and cost effectiveness. Care model design. Virtual health services need to be integrated into a seamless delivery process with coordinated care across the services and settings. So this means that you might need to adjust operational structure and staffing to integrate with virtual health workflows into regular operations. And what's really important to remember is that the virtual services that are provided and documented need to all go into a single patient record, that you can't have a separate record from the hospital EHR or the doctor's EHR. They all need to be together. Website manner training. Bedside manner, we all know, is important to patient health, and the more virtual visits that take place, training may help both the physician feel more comfortable and the patient more comfortable. Some website manner strategies could include focusing on the patient during the virtual visit, how to convey empathy and compassion over video, and then communicating with the patient while you're looking at notes and not making eye contact. So how do you make them feel comfortable with that? And in fact, it's been proposed that maybe there be a virtual specialist, so somebody called a virtualist, somebody who only does virtual visits. So virtual care is a must. Virtual health innovation can deliver services that are scalable, less intensive, and lower cost. It offers a competitive edge, and it will become common practice. The consumers and patients want it. It allows providers to attract and retain patients because providers can distinguish themselves in the marketplace. You remember, virtual healthcare is not commonplace today, but it is on the way to becoming commonplace. So offering it now allows that uniqueness. The evidence is also here that virtual is what consumers want. Virtual and in-person will eventually merge. Healthcare, bottom line, is a people business. It is also one of the most labor-intensive of all industries. Provider and payer perceptions of what consumers want must change along with the outdated approaches based on historical practices. There are people out there who will say, well, my patients don't want or need virtual care. They always want to come in and see me. Well, did they really ask their patients that? And do all of their patients want that? So those are the questions that need to be asked. Who are your consumers and what do they want? Virtual care meets consumers where they are through multiple channels. Providers can offer traditional and virtual care in a combination that works for them. And it has the potential to transform the delivery of healthcare. U plus virtual. This is the equivalent of 21st century healthcare. Comprehensive virtual health enables organizations to engage with patients and consumers virtually through their health journey. So providers who deliver high quality patient-centric care will be in high demand. So virtual is here to stay. It is reality. So we have 1 minute and let me answer one question that was submitted with the registration. And that is, what flow works for doing traditional and virtual visits? So that really is on the preference of the doctor. The doctor may want to set aside certain hours to do virtual visits, which include email or actually video visits. They may want to do the virtual visits in the same room that they do their regular visits, or they may want a separate room. The important thing in that is that they want the ability to do it quickly. So some have an assistant in the virtual room with the patient until the doctor arrives. Others don't want the doctor to deal with technical issues, so they have the assistant there and make sure everything is ready to go. And then, of course, as we talked about earlier, virtual care specialists. So I want to thank you very much today for joining me, and I hope that you got something useful. Our next webcast is What Do Patients Really Want on May 16th at 12 noon. Thank you.